Memorial Health System provides comprehensive health services that meet the needs of the region we serve, and we are proud to present Memorial Health Radio. Here's Melanie Cole.
Our topic is the field of gastroenterology, and my guest is Dr. Juan Tejada. He's a gastroenterologist at Memorial Health System. Dr. Tejada, tell us a little bit about the field of gastroenterology. What is it exactly that you do?
The field of gastroenterology is about the prevention, mostly, of especially cancers of the gastrointestinal system. But at the same time, we can treat different conditions, including dyspepsias and liver disease and pancreatic conditions. That is actually my specialty, which is advanced interventional endoscopy or endoscopic ultrasound, which is don't look just at the pathologies that are in the lumen of the gastrointestinal system. Also, we can see beyond that. We can see outside of the lumen of the gastrointestinal system.
What are some of the most common GI issues that you see and that people suffer from?
Most of the time, the complaints are gastrointestinal diseases, including, as I said before, dyspepsias or chronic diarrheas, which are disorders of the gastrointestinal system that a lot of gastroenterologists are available to treat. The ones that I see more in my specialty, which is advanced interventional endoscopy, is of those diseases that are involving the pancreas or the liver or any other conditions that has to be addressed with more careful and also invasive endoscopic procedures, including those large lesions in the stomach, colon, or small bowel that have to be removed with a special technique. When the general gastroenterologist is not able to remove these lesions, like the polyps, then they refer to me for more advanced techniques.
Tell us a little bit about some of those advanced techniques. We've all heard about colonoscopy as the single best prevention for colon cancer, and even endoscopy to look for Barrett's esophagus or lesions or problems with GERD. So speak about how those tests are used for prevention. And do you see endoscopy as going the way of colonoscopy, where it might become the standard of care for prevention and part of a wellness workup?
Yeah, definitely. Colonoscopy is one of the procedures that prevent colorectal cancer. But also, we are going beyond the spectrum of just identify a lesion and remove small polyps, which are lesions that can become cancer in several years. So now we are also able to remove those lesions that are larger in size, and also those lesions that just involve the mucosa, which is the first layer of the gastrointestinal system, and we can actually remove those without have to remove the colon. For example, a large polyp that previously was referred to surgery for the removal of the colon because it was larger enough to don't be removed by endoscopy. Nowadays, we can actually use a technique which is called endoscopic mucosal resection and also endoscopic submucosal dissection, and we can remove the lesion that is located in that specific portion, and we don't have to remove the portion of the colon, sending the patients to surgery for that. Also in the stomach, we can do the same, and the small bowel and the duodenum. Endoscopic ultrasound is the other technique that I can perform, which is endoscopic biopsy of those lesions that are beyond the lumen of the gastrointestinal system, including the pancreas. Nowadays, pancreatic cancer is the following the colon cancer. So it's the fourth cause of death from cancer in the United States. And now we are starting to prevent this cancer based on the early screening. And because we have endoscopic ultrasound, we can actually look at these small lesions in the pancreas, which mostly are called cysts, and we can actually drain those. And we can send it for fluid analysis, and we can prevent that the disease develop and progress to pancreatic cancer.
So now speak about some of the other issues that people deal with, such as bloating and IBS and even Crohn's and ulcerative colitis under the umbrella of IBD. And what can a gastroenterologist do for people in those situations?
Again, now in the gastrointestinal specialty, we are advancing in the detection of several conditions that are associated with all these disorders that is in the previous times as they were called as idiopathic or something that wasn't really specific, and the answers for the patients was always diet or just try to wait and see if this is going to change. But now we have several actually testing arsenals that we can use, including breath tests, including Bravo testing, which is the pH monitoring. We have the manometry studies. We have a lot of tools nowadays to narrow the diagnosis list, especially for those patients that are complaining chronic functional dyspepsias, as we call, that actually are real disease, but because the lack of the testing tools, they were not able to be detected, and the patients were suffering for these diseases for a long time without any treatment.
How is gastroenterology working along those prevention lines? Speak about things like probiotics and nutrition and how that can help with GI disorders.
Of course, we always have different treatments that also we can use as a coadjuvant. That means something that is going to be in addition of the primary treatment, just to help to, so for example, probiotics can help with the balance in the intestinal flora. So we can have the primary medications or primary treatment working better. It's like when you have any conditions that you require an additional help. So we have also the diet, like FODMAP diet, in patients with irritable bowel syndrome or patients with some source of sensitivity to the food. So we can add this specific diet to improve the outcome and to help with the primary treatment.
Then give us your best advice as you wrap this up about the field of gastroenterology for us, Dr. Tejada. Tell the listeners really what you would like them to know about the ways that they can hopefully prevent GI disorders and the symptoms, the red flags, the things they should look out for that would send them to a gastroenterologist in the first place.
Right. Any symptoms of weight loss, any symptoms of rectal bleed, any family history of any conditions, including conditions that are related with cancer, familiar disease for colorectal cancers, or any family history with pancreatic disease, pancreatic cancer, and upper gastrointestinal system, including esophagus, stomach. If you have any data in your family or any other conditions that are associated, it's better to have it assessed, because now in the gastrointestinal field, we are breaking those boundaries of just to do a colonoscopy, endoscopy, and try to find something. We also gonna be able to treat, prevent, and follow those everybody that has some specific condition, including those patients with polyps. We can actually continue and find if there's any relationship with family conditions or syndrome that we can actually follow closely. It's not a specialty just to look and treat something. It's a specialty to follow, and it's a specialty of prevention. Because the thing is, if you have the message that the prevention is way cheaper than treat a disease, then together we're going to be able to prevent and also following through the time and establish a communication that is going to be improve the humanity.
Thank you so much, Dr. Tejada, for being with us today and sharing your expertise in explaining gastrointestinal disorders and really what a gastroenterologist does. It's very helpful for people that suffer from these types of disorders. Thanks again for joining us. You're listening to Memorial Health Radio with Memorial Health System. For more information, please visit mhsystem.org. That's mhsystem.org. This is Melanie Cole. Thanks so much for listening.